Can you introduce yourself and just where are you from and how has this journey been for you?
As from so, my name is Dr. Monis Khan. I've completed my government Doon Medical College, Dehradun, and
Okay,
batch 2018. And this was my second attempt in giving this NEET PG exam, and I got a rank of 2479 here this time. And throughout my journey, I have never been a good student. I would call myself as a below average guy, and I
okay,
in my MBBS, I never studied in my internship. It all started after the internship actually, and
okay.
when it started from the day one, it was Cerebellum Academy, and here I am right now. So I'm the guidance of all
So,
teachers. And
so you did. So, how did you first get to know about Cerebellum Academy? Like, who introduced you to this academy?
ma'am, I saw a video on YouTube on one day. My internship was almost over, and I saw a video in which Praveen sir was there and Govind sir was there, and I saw that such a legendary faculty is standing there. What are they trying to say?
Hmm.
I just saw the video.
Yeah.
They were telling
Okay.
of mission classes, and I have
Okay.
such live classes concept before. So I thought that,
Okay.
and when I enrolled in that mission program, ma'am, that was super amazing. The all the faculties coming on day one, meeting the students. I mean,
Hmm.
I've never felt like that before. हम लोग को मैम
Hmm.
मेडिकल कॉलेजेस के वो खड़ूस टीचर्स की आदत होती है. When
Yeah.
we all saw all the teachers coming there and such a friendly environment, I felt that
Yes.
the right place for me. And from then it
Okay.
a great
So you
journey.
enrolled into the mission schedule that we were going through,
Yeah,
right?
yeah, yeah.
Okay, so that was your basic work. Okay. So you're saying, so this was your second attempt. You gave a first attempt during your internship, right? And even then, I think you got a 33,000 rank or something.
Yes, ma'am. I studied like for 1.5 month and so, and it was because of Cerebellum Academy. I didn't believe that how I achieved that rank as well because I just told you that my foundation was completely shaken, and I have no idea of subjects like microbiology, pharmacology.
Yeah.
So
Hmm.
I think I'm going in the right journey. I should give a serious attempt now, and
Okay. So you
this
started your serious preparation after your internship, right?
yes.
That was your okay. So then how on an average, let's say how many hours did you study, like, for all of these exams? Like how many hours did you put in actively for studying?
Ma'am, I started from I build on it gradually. I started from like 7 to 8 hours initially, and then towards the exam, before 1 month before the exam, I was kind of studying like 13 to 14 hours. Actually, Praveen sir just said that you have to 12 to 14 hours should be your benchmark, and you should
Hmm.
also the concentration levels. So I just
Hmm.
I wrote down that on a piece of paper that every day how many hours I'm clocking, and I used to write down the concentration level of every hour. So that
Okay.
all
How would you tell like how would you write the concentration hour or every? I'm just very curious to know.
and I would give a concentration rating on a scale of 10. So if I was completely submerged into the books, so I would give like 9 out of 10 or 8 out of 10.
Okay.
If I was completely
Okay.
give like 4 out of 10 and 3 out of 10, so that
Okay.
we tend to think that we are studying like 12 to 13 hours a day. But when we start monitoring those hours, actually we realize it that we are studying like just 7 to 8 hours. So that was something I got to understand from Praveen sir and from Zena ma'am as well. So they just told that
Hmm.
monitor of time you are spending in studies and also the concentration levels. So
That
thank
is actually good. So was there any schedule that you had when you were, preparing for this? Did you go by whatever Cerebellum was telling you? Did you have your own schedule? Because obviously schedules can be a lot of hectic, it can be extremely hectic. So you have to kind of modify them as in how you go. So did you have any schedule of your own?
No, I actually followed whatever schedule was coming in the Cerebellum Academy. I mean, it was just like spoon feeding for me. I just had to show
Hmm.
up. If there was
Hmm.
microbiology, ma'am, you have to take an E&D after 2 days. So
Hmm.
that I have 2 days to complete my complete microbiology. I will complete the microbiology. Whatever PYQs I have to revise, I will revise them, and then I will sit down for the E&D, and this will give a good closure to the subject. So I was just following the schedule here, and this is what I think is the best thing about Cerebellum Academy is it's just like you have to show up every day. You don't have to
Hmm.
train to go or look for PYQs, look for MCQs or E&Ds. I mean, I just need to sit down on the chair and just keep on studying, and it was all simple and so easy. So
So
it
like
was.
just Yeah, so like the mission classes, like they go. So were you adding something yourself into the mission classes that you were attending? Like maybe after the class, were you doing any questions or were you just revising whatever was taught? Did you come prepared to the classes? So was there anything that you were doing differently from others?
Ma'am, I used to, for example, if class was start at 5:30 p.m., so I would just attend the class seriously. The next day, ma'am,
Okay,
revise the class. So I would
okay.
that has been taught there. Then I would attend the late night PYQs if the class was going on till late, so it was not possible to to attend those PYQs in the night session.
Yeah,
I would
yeah.
then review them. Whatever PYQs I didn't had any idea, I would annotate them. So because I knew that Praveen sir has been emphasizing on it a lot that PYQs should be something कि आपको नींद में से भी कोई उठा के पूछ ले तो आपको.
Yeah. PYQs are not to be missed, definitely.
So I was annotating them in my notes. That was something I was just doing. That I just need to get hold of these PYQs, and
Hmm.
I revise them thoroughly, and I would get a basic idea of the next day lecture that has to be taught. Yeah, yeah. I think I will just get a gist of what it's going to be taught the next day. So this was all I
Hmm.
would the midday modules, the
Midday
custom.
modules.
I would
Hmm.
also so I think I all the basic pillars of any NEET PG preparation were being taken care of. The PYQ portion, the revision, the MCQ solving.
Hmm.
That's it. So I didn't had to make any master plan or something like that. It was so simple
So
here.
you were basically just following whatever Cerebellum was telling you, and it's kind of worked for you, basically.
If I could just religiously follow this schedule, I could achieve any rank. And
Hmm.
because I could, if I could have just smartly do a little bit of more thing, then I think I could have got a even better rank. But it's good.
No, but the rank that you've gotten is extremely great still. So basically, so you were saying you did a lot of revision and you were doing MCQs along with it. Did you go through the Q bank or something, or were you solely invested in the E&Ds and the grant tests and the PYQs?
Ma'am, initially I tried to solve some custom modules, and but
Okay,
I think around December or November, Praveen sir said that we are gonna make our own custom modules known as the midday modules, and you just need to follow them. Then from then on,
okay.
I was going on with that midday modules because custom modules in itself can be a resource, and we can get lost.
Hmm.
So
Yeah, that's true.
that midday modules really helped me. And yes, E&Ds, I attended all the E&Ds. Any question I used to get wrong, I just used to annotate in my book, and GTs I was giving as and when they will come in the app.
So what kind of a ranks were you getting or marks were you getting in the GTs? Because I was just talking to somebody and they said that somehow GTs were even tougher than the NEET exam that we were giving because it is, it gives you like a idea of what an exam will be. So like, how are you going about that?
I think Cerebellum GTs were the closest to the exam. They were resonating
Hmm.
so close to the exam. In the last GT, I got around like 165 correct in the last GT, and in the main exam,
Okay.
9 correct. And this was the portion. This was the range of marks I was getting around. In one GT, I
Hmm.
got close to 170 and 162, but this was the range which I was getting, and I was kind of disheartened yesterday when the scorecard came in and saw that 159 were correct. But I knew that
Hmm.
uh, this is all fine. I mean, you cannot just. But it was so close that when I gave the INACT exam, it was just like I was giving another GT, and when I sat in the NEET
GT.
PG, it was just like I was giving another GT. So it was nothing new for me, and there was a.
Hmm.
So these GTs were great. They helped me a lot on the day of exam.
Okay. So, then what were your what were the resources that you were using to prepare for your exam? Like, Cerebellum, maybe there are so many resources that you can have. So, like, did you have anything apart from that? Did you just completely use this? How were you going about it?
Was just sorry, when it was just the mission classes itself, and
Yeah.
again said that anyone who can just revise those mission notes 3 to 4 times, they can achieve any rank if they can religiously follow
Hmm.
any rank. There was no resource. No, I didn't have any app installed in my mobile phone, and it was just a Cerebellum and Cerebellum only. And apart from that, you have the guidance, and you need to
Hmm.
patient within yourself. You need to have the discipline. And me being an average guy, also want to just tell this thing that I think in any entrance examination, the average guys are the most dangerous one. I mean, they have a and they when they just have that determination that I'm gonna sit there, and
Huh.
and they have a lot to prove to themselves, to the family, to
That's
their
true.
years and all that. So I think any entrance examination, the mediocre guys are the most dangerous ones if they decide so to do so. And in my case, I was very lucky that I found such legendary faculties there and Cerebellum Academy, and just it was so straightforward
That
for me
is
then.
that is great. So, were there any subjects that you prioritized over the other subjects because you felt that they were your weaker points, or because you felt that you were stronger in them? So, ऐसा कोई है subject जिसमें you were just giving more, input versus the others?
The second prof subjects were something ma'am, I didn't had any idea about, and
Yeah,
I
I think a lot of people are saying the second prof subjects are extremely confusing, and like I think there's a lot of things to kind of mug up in the second year subjects. Yeah.
basic foundation for yourself. And if you are aiming for INICT, we all know that, so how much importance it carries. And
Yes. Yes.
that foundation was built so strong within months, like microbiology, pharmacology, and all subjects. I was just like, it helped me in solving medicine questions as well, because when you have
Hmm.
a foundation, then you can excel in those final year subjects as well. And my
Hmm.
surgery was also very weak, so I especially emphasized on surgery, and Amrit Nasta sir did a fantastic job. I mean,
Yes, he's amazing.
for me, I mean,
Yeah.
surgery was like a cakewalk for me then from then onwards. And just not to
Yeah.
mention Vivek Jain sir and GRG sir, they
Go, sir. Yes, yes, you can go ahead. Yes,
are.
yes. They've been my teachers. So like I can like I'm in awe of them all the time. Every time I meet them, I'm still like acting like a student in front of them because they have been I have studied from them. So I can completely understand what anybody can feel in front of them. So yes, that is true.
And my microbiology was also good. I studied from Priyanka ma'am as well.
Priyanka
And
ma'am, yes.
I gave your E&Ds, and
E&Ds.
got very few very important tips that you said, that we have to look for like words like there's nothing like only in medical field. There is nothing like
Yes.
there are always
Except in media, there's nothing like only this will happen.
just
Yes.
helped me in the final exam as well. I was like, never thought it that way, that this can be like this
Mm.
also. I was like amazed from that tip, and it helped me in everywhere. And a lot of mnemonics you used to give in those E&Ds. I mean, that was just simply amazing, man. Thanks to you.
Great, great. Also, because this is such a tough exam, and like, you go through a whole year of preparation. So I'm sure you must have gone through some low points in your life. It could be maybe a personal thing, maybe a professional thing. So, like, how did you manage all of that?
Ma'am, yes, and there were points that I felt like giving up. When there was a point when I was giving a terrible score in the GTs, and sometimes, you study a subject for you have a 2 to 3 round of revision, and just sit on a END, and other students are scoring much better than you, and you feel like that.
Mm.
I think my caliber is not enough to crack this exam, and there were points that I thought that I am not made for this exam. So I think
Mm.
just they were really bad days, and on that days, and it was like a magic that on the days I was feeling the most low, Praveen sir will drop a message or drop a video on that day, or a recording at the night time, and it just used to give me a booster shot, and I just gather myself up, and just I told myself that I need to give my best shot, and whatever the result will
Mm.
readily accept it, but I need to focus on the process, not on the result. So that's what something which I kept telling myself, just keep looking on the process, and just look on what you can do to improve, and there are teachers who can guide yourself, and all the faculties giving their mobile numbers, replying
Mm.
2 at night, and I could reach out to them. A lot of faculties helped me. Ankur Jain sir helped me a lot, and he called me even once to help me
Mhm.
solve my doubts.
That
So
is so sweet.
that's just amazing, and I can't thank enough to all the faculties, ma'am.
That is great. And let's talk about on the exam day, what did you have any strategy in mind that acha, I have to attempt these many questions, I have to give this much time to the A1 question? Like, did you go with any strategy or you just went with the flow?
No, ma'am. Actually, my problem has been I used to not complete the GT on time. So this was my strategy, that I need to complete 5 minutes before the each section ends. So this was the strategy which I kept telling myself, even though I could not
Hmm.
do it on the day of exam. I was just touch and it was just touch and go, and
Yes.
the timer was
It's a
just.
very stressful day, na, because you plan so much, but it is so much stress comes that sometimes the planning doesn't go well.
I think the one who remains calm on the day of exam, not much planning. You need to plan till the very last time. As Praveen sir says that take your preparation to the last day. Sir said that
Yes.
a 10 p.m. point. So I was planning till 10 p.m. After that, I just, just I was just feeling. I just listened to a song and I just sat down on my on my with my pillow, and I was just like, no, whatever we need to do, we needed to do, and I have done it, and now we will see whatever happens tomorrow. And I think जो काम रह पाएगा एग्जाम के दिन में उस दिन उसी वो ये कर पाएगा
So you
एग्जाम.
had good sleep before you went to the exam, you
So
know?
I'm not serious. I tried to, I
But there's so much stress was happening.
just
Ah,
like 5 hours only. I tried, but I
okay.
just do it.
So good. So now that you have this rank, what do you have in mind? What do you plan to take? What is the subject? Are you getting the subject that you were planning to get?
Yes, ma'am. I'm planning to. I have always been, aspiring to do MD medicine. And right now, I'm a little bit of confused between MD medicine and MD radiology. I'm just introspecting myself that what I need, what I want in life. But I think I will
Hmm.
do medicine now, and that's
You're going to be doing.
also, ma'am, to look into that from clinician point of view, and I'm gonna go with.
That, yeah, everybody I think gets into medicine, MBBS branch thinking that we want to do medicine, but it's extremely good. I think you will definitely be getting that in this rank. But I would just suggest that just because everybody is taking radio, don't take radio. मतलब ऐसा नहीं कि just because आजकल it's the buzz that everybody is taking, but do the branch that you've always dreamt of taking. If medicine is that branch, go ahead. Like if radio is that branch, go ahead, because this is something that is going to decide your career for life, right? It's going to be next 30, 40, 50 years of your life. So if you're thinking about something and if it is something that you've always wanted, then you should definitely go ahead with it.
Yeah, right, ma'am. Actually, ma'am, everyone's saying that you can get radio, you can get radio. I've started thinking of radiology, but I've never imagined
Hmm.
of not interacting with the patients, and
Hmm.
pressurizing yourself that you can get radio, you have a good work-life balance and all of that. It looks cool doing MD medicine, but once you go down there, I think you're right. I need to just introspect more that what I wanted.
Yeah, just talk to people. Talk to all sorts of people. Talk to people who are in radio. Talk to people who are in medicine. Get to know their life and also decide how how you see yourself in your life. Like, do you want to? Are you that person who will give everything and be, yes, medicine is too much of a demanding subject, so you have to give it your all. So, thoda ye Uttarakhand घूमना could be reduced, maybe, which maybe you can do in radiology. So, malab, that is something that you can prioritize and see that which path that you want to take. But yes, definitely, I think go with your dream branch, whatever it might be. And I think it's a great achievement that you've gotten this rank, and definitely you will be having so many options. And it's good to choose from options that you have. So you've done so much, and it's an extremely, I think, good attempt. And congratulations again.
Thank you
And
so
finally, lastly, can we just conclude in saying that there are so many aspirants who look up to the toppers and people who have achieved so much, and they always want to know like two or three things that you did that helped you, and two or three advices that maybe you would want to give them that maybe you learned from your mistakes or something.
Yes, ma'am. I think first of all they need to clear in mindset that consistency is the key. You need
Yes.
to obsess from the day one of the exam, and till the last point, till the last day, you have to be consistent. I just told myself that when on the day of the exam, when I will walk out that room, I should be able to tell myself that I didn't take a day off. I didn't, just went out there and I was just partying or hanging out with friend. And I was able to tell this to myself. And I think consistency needs to be done, even if you start slow. Even if you are, you start slow, it doesn't matter. But if you are consistent, definitely you will reach there. And another thing I think which a lot of students do wrong, I think that's going on to a guilt trip when they have wasted a
Mm.
time. आई थिंक मैम इट जस्ट हैपेंस विद एवरीवन. हम 4 घंटे अपने वेस्ट कर देते हैं, देन उसके बाद फर्दर 4 घंटे और वेस्ट करते हैं सोच के कि हमने तो 4 घंटे
गिल्टी हो गए हाँ ट्रू
through this. And if you can train your mind for this, that you need to focus on what's ahead, I think you will
हम्म
go ahead of a lot of students, because even the topper have these days, the bad days and
हम्म
days. So don't go on to a guilt trip, maintain consistency. And you need to fix a resource. I think this is something which is a lot of students have been doing wrong. They studied biochemistry from 2 months from one teacher, and they change it because of
गिल्टी
some of their friends telling themselves. So just be focused that where you are heading towards, and I think you will ace through the exam.
Okay. So I think that is a great tip that you've given. And I think anything else that you just want to say, anything you want to pour your heart out from, go ahead.
I think yes, ma'am. I this is thing that me being a mediocre guy, being a poor guy in medical school, this is very close to my heart. And anyone who is watching this video, anyone who is thinking that problem with being averages, हम लोग अपना स्टैंडर्ड बहुत लो कर देते हैं कि बस थोड़ी ठीक ठाक सी ब्रांच कोई मिल जाए और बस इतना ही काफी है।
Hmm.
लेकिन अगर आप अपना स्टैंडर्ड बहुत लो सेट कर देंगे तो आप मैक्सिमम कहाँ तक जा सकते हैं? जो गोल आपने सेट किया है वहीं तक आप मैक्सिमम जा सकते हैं। सो डोंट सेट
Hmm.
set your standards to the maximum. Even when I started preparing, I thought of myself achieving a rank of under 500. I could not achieve,
Okay.
but I reached somewhere around it. So, and but that was pretty good. अगर मैंने अपना एम अंडर 5,000 रखा होता तो आई वुड हैव गॉट समथिंग अराउंड दैट 5,000 6,000 और 4,000. So I think set your
Yes.
standard side. Doesn't matter if you have read standard textbooks or not. Doesn't matter if you have failed in your prof exams or not. You are from private college or government college. Doesn't matter at all. You can achieve any rank. It's just you need to have a focus, discipline, and that belief within yourself that I will be able to do it, and keep the fire within alive. That fire is what that's needed to crack any entrance examination. Your parents will telling you that go and achieve, study. You will not study until unless that's coming within from you. And if that's
Yes.
coming,
True.
you do everything that's needed to be done, and that's what I did.
Okay, that is such a great tip and advice. Thank you so much, Monis, and congratulations again. I hope you will take up medicine and then I will, have another medicine person that I know. But congratulations and enjoy your Uttarakhand trip and be back safe,
Yes.
right? Okay. Chalo. Bye bye. Thank
Bye.
you. Take care.